Hi, it's Tammy. I have a word today that I want to kind of build this little video on, and that word is grace. It's been on my mind for the last couple of days, and interestingly enough, it actually works with it falls very easily into the way we use essential oils and the way we actually treat the body when it comes to health conditions and wellness. Um, so grace to me, um, it's it's a big word. It's a really big word because what it does that it actually allows us to find compassion. It allows us to kind of stumble, you know, if and still come out, composed. I mean, learning how to dance when we stumble, I guess, is another way to say that. So, like if we step over something and, just kind of creating a dance. And that's really where I want to take this, because healthcare really is more about a dance than it is about a regimented way, such a harsh way of affecting change. When we actually allow the dance, you find grace, you find compassion, you honor. It provides honor. Grace, not only does it allow what's real, it honors the individual. And when we're talking about a relationship, it doesn't make any difference. When we come from that space of grace, we are allowing the opportunity to honor all parties involved. When we're talking about healthcare, we actually provide, we honor the body. We provide this space of what does the body need right here, right now. And we find compassion and unconditional acceptance, not as a means of this is as good as it's going to get, but just accepting what is, understanding it's a message. That's what it is. When there is a symptom, it's a message. That's what neurotransmitters and hormones are actually referred to as. They're called chemical messengers. So when anything goes out within the body, we get a message. And when we pay attention to that message and we actually experience the grace to our own wellness, we are listening to these messages and we are adapting. Another place that I find grace, and I can see this actually mapping into, and I'm really excited because I'm about to launch into what's next for me in my life. Not stepping away from this by any means, whether it be videos or working with people, but I really want to branch it into an entirely different aspect that I'll say more about once I've kind of honed it in. But with that in mind, when we talk about yoga, I don't know how many people, as far as I know, it seems to be growing in popularity. There's varying branches of yoga. Yoga, for me, is an exemplary example of grace. When you practice it, even with the traditional schools of thought, I'm going to say it that way. Pardon me for anybody that does practice or teach yoga if I've offended anybody. I don't mean to do so. It's just really, there's different branches of yoga. And no matter how, it's not so much about the power yoga and the cardio yoga that we find. It's more, there are some people who are adapting their yoga practices and their yoga teaching to incorporate the hatha yoga, the ashtanga, and blending it with strength and flexibility. They're doing a really beautiful job of combining yin and yang. So you have the ebb and the flow, right? It's when I begin to get into practicing like that, and I do practice yoga every day, I find a lot of, I'm finding a lot of more grace for myself. Not because I think I hold the perfect pose. It's more of an allowance of where my body is on that day. It's so funny when I talk about nutrition and pharmaceuticals and essential oils. We talk about the chemistry, And at the same time, there's the structural component of the body. And yes, the chemistry does interact with the structural component, but there are days that, you can structurally tell you're tighter on one side, there's pain on one side, depending on what you're doing or where you're going. You may actually find that you're a little bit off balance, or you're not 100% there, or there's so many different ways that we refer to this. And so therefore yoga actually provides that place of grace where you actually recognize that your body is different than it was yesterday. I mean, that's if you even have practiced the same thing every single day. You can go into even other practices. I mean, I've noticed that I change my sequencing every day, and because I no longer want to practice the same thing, because again, we're always in a different space, mentally, emotionally, and so therefore everything's affecting. And so I kind of get called into or feel drawn to a particular sequence, and I do it, and it doesn't make any difference. I noticed, like today, for instance, I was really out of balance. I was having a very hard time holding a balanced pose, whereas yesterday, piece of cake. So with that said, these adaptations go on all the time, and learning to just accept. That's the reason why I like yoga, because it actually teaches us in a very brilliant way to just accept where we are, and learning to accommodate and make the adjustments so that we're still comfortable, we're still getting benefit in our day, and at the same time honoring where we are in that moment. It could very well be, if you're out of balance with no matter what you're doing, it could be the way where your thoughts are. That's an interesting correlation that I found there, that when your thoughts are off in yoga, it's almost impossible to hold a pose for any great length of time, and especially the balance poses. You find yourself off step with the instructor. I mean, there's just if you're just not there, if you're worried about all the what ifs and what I should be doing and what if I should have done this, it doesn't make any difference. If your brain and your mind is not centered on what you're currently doing, and in this moment, you can't pull it off. It's the best way I know how to say it. You just can't. You will stumble and fall. I've had it happen too many times where I can be doing just fine, and all of a sudden my mind just goes over here to think about something, and I fall, or I fall out of it. So, and again, like I said, that's a really great correlation, because this is exactly what happens within the body. I mean, if you can just notice those subtle changes in your thought process alone, you haven't changed your hands, you haven't changed your feet, and yet you've changed your thought process. Now all of a sudden the body can't do it any longer, and it falls out. This is exactly what happens in the body when it comes to the chemistry. So I want to say that up front, thoughts do affect our chemistry, and on any given day, our thoughts are affected by so many different things. The information coming in, the distractions from friends and family, the news, the tragedies that we're seeing in the world right now. I mean, it's a frightening, scary place, and in so many respects. And yeah, and I mean, I'm really present too right now that I've had a couple of my kids actually ask me why I would bring them into a world like this. These are adults now. So, I don't take it personally, but I do understand the questioning, and I can understand that that's probably going on in so many other people. And so with all of that information coming in, our thoughts can be altered. And even if we're not even present to what we're thinking, but these are just, tapes that are running in the background and really affecting the choices that we make throughout the day, it is affecting the chemistry. You cannot deny the fact that these shootings and the tragedies around the world are not affecting you somehow, that you're not stressed about it and that you're not concerned about, whatever you're thinking. This does affect your health. So again, like I say, the thoughts do affect the chemistry, and being able to adjust yourself with grace. Am I making it bad and wrong to have these thoughts? No, not at all. It's perfectly normal. I'm going to use that word, normal. It's a natural human reaction to be concerned about your well-being and the well-being of your family and the safety that goes along with that. So this is not to make anybody wrong for having these thoughts. This is just simply to say that this will affect the chemistry, and therefore now you've got a change, and you may experience symptoms. Symptoms could be anything. It could be just an increase in, slight change in blood pressure. You might notice that your face can get red. My sister has this tendency to get like the décolletage will turn, kind of start to get splotchy. Our respiration, the way we breathe changes. So these are just some of the slightest things. Now, over time, if we're not paying attention to that and allowing that to let us know what we need, then with time, we start to see other things. And again, that's different for everyone. It really depends on what's going on with you. So with that in mind, I would like to kind of elaborate on a large part of the reason why I wanted to do this video today, and that is because of the chemical changes that occur in the body. And it's not necessarily, it could very well be in relationship to thought. It could also very well be in relationship to what we're exposed to. And I've had, I've had clients that, they get into this regime and they want to stick with a particular blend, and they comment, well, I don't know if you want to change it. And the answer typically is, yeah, I do want to change it. Although if everything is kind of still status quo and there's no variations, then definitely you want to stick with the same one until you see a change. With autism, I suspect there's, we know there's a lot of sensitivity to the world, and I think it's much broader than we realize. I mean, we talk about sensitivity to sound. They are, as far as I'm concerned, incredibly sensitive to those around them. They're not able to articulate it as well due to the differential, the different brain structures. And it's not extraordinarily different, so it's not like their brains look different than ours. There's different areas of activity. They do know that there are variations in specific genes. Does not make it prone to autism. It just means that you've got differences in your genes. But there is some similarity to those, one of them being the FOXP2 gene, which is related to speech and language. But they've also found that that particular gene sequence, or complex rather, actually affects the neurochemistry. And so I believe heavily in that particular gene with regards to autism. And because it's regulating chemistry differently, there's a hypersensitivity. There's even more sensitivity to the world around them. So it's not just what they what they hear. It could very well be what they see. It could very well be what they sense. If you sat and got really quiet, if you kind of removed yourself from a stressful situation, so kind of like you're in a stressful situation and you extricate yourself and put yourself over here in a quiet room, and you are doing what you want to do, and there's no inundation of information coming in, whether it be stress or anger or whatever, you may notice that you actually feel different. And this is a really great experiment to try, because you can, at that point, feel how things adapt that quickly. This is what I feel like is going on with autism, except that with autism, we're not recognizing it, and we're not seeing it as a, there's a lot of, I shouldn't say that it's not 100%. There's an extraordinary number of people that are professionals as well as families that are really wanting to make the point that autism is not a disability, it is an ability with a different processing system, which I completely align with. In fact, what I see with everyone is that we all have our own processing system, depending on where your neuroendocrine system is, those chemical messengers. So you have these kiddos that are hypersensitive to the world, and it's not always the same. It changes between them. It could be light, could be sound, could be just the tension in the room that nobody even is addressing that child per se. They're just dealing with their own stuff, their own life situation, and or their own concerns about the world or whatever is going on. It could be financial, it doesn't make any difference. Stress is stress, and it affects us all in very different ways, and that child can feel that. So we have to recognize that. The other sensitivity that I find is that their chemistry changes rather rapidly, and this goes for a lot. Actually, this goes for everyone. I'm not going to just say a lot. This goes for all of us. Um, but I'm talking about autism because I actually had an interaction this morning with the family where the daughter was doing very well on the specific blends that were designed for her. And all of a sudden, the last 4 days, she's gone into these major meltdowns one more time. Although there's a lot of, as we know, colds and flus going around. Mom and dad were fighting off their cold and flu and fortunately did not get sick, although their daughter started having these major meltdowns where she was waking up crying and, very sad. She was easy to soothe, but she was still having a very emotional upheaving, the emotional upheavals were just consistently going on. And so initially I thought, well, when you hear sad and crying, you think depression, right? And some of these kids get placed on antidepressants, and I don't do that. And in my position, I don't necessarily believe in that, which would probably get me in a lot of trouble. If you are on antidepressants, it is possible to support the antidepressants very nicely with essential oils to help accommodate the differences in the adaptations that are occurring, again, to the chemical changes, because, and I'm going to mention this in just a moment, it's actually very, very important. So anyway, you hear sad, and so we're already working with the hypothalamus, the pituitary, the adrenals, and it would make sense to think, well, serotonin or dopamine. Those are the two typical ones we go to when we think of depression. Histamine, yet, is another one. And what I recall, instantly was that mom and dad had been fighting off an illness. And even though this little girl had a clear runny nose and she wasn't really acting sick, she was all of a sudden incredibly upset and cranky and having, easily distraught. I mean, in the middle of the day, because she goes to ABA therapy, in the middle of the day, she would have a lot of just out of the blue meltdowns. So when I heard histamine, I didn't hear histamine. I heard histamine in my head. But when I was thinking dopamine, serotonin, it's like not what we really want. We want to inactivate the histamine, and the potential for estrogen to increase is there. Because if you haven't seen anything until this point, histamine causes estrogen to go up. And so when you have one, you have excitability, you have irritability, and you can have depression. So what I do know is what she's currently using is helping with the histamine slightly, but we needed to kind of kick it up a notch because my suspicion is she's fighting off an illness, not necessarily sick, which we seem to think is the reason why these kids get more aggravated. She doesn't have to be sick. She can simply be fighting something off. And that is going to adjust the chemistry in the body. And with autism, they're just that sensitive. So recognizing that, so I actually made a different suggestion with the oil, told her to stop using one particular blend for the time being until we can get the histamine and the estrogen levels into balance. You're probably wondering how I even know this. Well, I don't know for certain. What I do know is the symptoms and how symptoms correlate. I mean, they just across the board. You can have depression with low dopamine. You can have depression with low serotonin. You can have depression with high histamine. So, I mean, my goodness. I mean, any of us still having menstrual cycles, and for that matter, if you already have had them and you're familiar, I mean, we all know with estrogen, we can find ourselves in some rather emotional states. So this is a reasonable thought process. And what I said, like I mentioned, is that we already are working with the hypothalamus and helping to support the brain, but that doesn't make it foolproof. That means that the brain is being supported, the body's being supported, but right now there's a chemical change, and we need to adjust our approach in order to accommodate and soothe her. Because of the sensitivity. So there again, I'm not claiming this, and by any stretch of the imagination, am I claiming this is a disability. This is a wonderful sensitivity, and they are actually teaching us, they can actually teach us just how sensitive we all are when we pay attention. So, like I said, with the chemical messengers, an alteration can occur on any given day, no matter what. It could be thoughts, it could be trying to fight something off, it could be the introduction to a new chemical that you weren't, that you're not familiar with, or it could be something that, you may not have been having any problems with, and all of a sudden, boom, now there's a symptom. So, writing it off as nothing is not advisable. Reacting to it the first day is not recommended, because you want to see if the body can adjust itself. Like I said, this particular client, they gave her 4 days, and after 4 days, it's not getting any better. So there's something happening. They contacted me, and I believe we got it straight. So with that said, the chemical changes. So it could be, a lot of us know food. Food does that for us. Some of us have food sensitivities, also known as allergies, which I believe are more sensitivities. We have food sensitivity that, may cause gas and bloating. I don't know how many people, that I'm speaking to have had ever eaten anything and then all of a sudden felt like their heart racing, or they felt anxious and they didn't feel good. I'm not just talking about nausea. I'm just talking about, within 30 minutes of eating something, all of a sudden realizing that you're not feeling too hot, and, if something feels off, it doesn't feel as good as you did before you ate. Those are chemical changes. This is also the reason why pharmaceuticals only last for so long, and why we end up having to either up our dosage, alter our meds, and or add something to it. It's the chemical changes that are occurring, and we have to keep up with it, and that is symptom relief, dealing with the symptoms. So when I talk about chemical changes, yes, I'm talking about symptom relief, even in the realm of essential oils. And oh, by the way, I did recommend clary sage for this little girl, because it does help with both dopamine levels as well as estrogen levels, and helping the metabolism and the breakdown of estrogen more appropriately. So with that said, when I said with regards to medications, you're going to have chemical changes, but you don't want to just react to it. And this is the reason why things happen the way they do when we see our physicians, is they have to be altered because we're addressing symptoms. Did you notice I kind of got a little off track because I lost my train of thought? So now that I'm back on the train, symptom relief is what we are after. In my realm, it's not just symptom relief, it is also, and this is very important, the long-term effects. And this is where pharmaceuticals fall short. Their long-term effects are actually subversive in the body because they are not a complete plant product. They are lab synthesized, and they have adverse reactions within the body that sometimes we don't know about. And that's the reason why using essential oils alongside of the pharmaceuticals is incredibly beneficial. They've noted this in numerous European researches. So this isn't something that I'm making up. This is something that I completely adhere to and strongly encourage. So now that I've mentioned pharmaceuticals, I need to be really specific about herbs and oils as well, because we've talked about the foods. Foods can have this effect on us, but as do herbs and oils. For that matter, even our supplements. We take them for a while, we feel great, then all of a sudden we don't feel well. Supplements, depending on the type of supplements you're taking, unless it's food-based, and it would say actually food-based on the label, or plant-based, or, something along those lines, you are not getting oftentimes the complete nutrient, full nutrients. You're not getting all your vitamin A, you're not getting all your vitamin C, you're not getting the whole thing. You're getting a type of calcium. So it's really important that they become food-based, because at that point the body actually recognizes it. So this is the reason why we can take supplements and all of a sudden don't feel good, or they're not giving us the same bang for our buck. The same thing with herbs and oils. I can't tell you how many times I've talked to people who have said, well, I did that and it worked for a while, and then, and it didn't help, or it didn't help at all. Well, it doesn't help at all because it wasn't necessarily meant for you. This is why I work with what I call client-specific or bio-individuality. It's actually helping people to discover what works for them, and what their body is going to need. What qualifies me to provide you with this information is I've been studying this for 30 years. I've been applying and adapting this to actually suit, and it's really difficult for me to come out and speak about to speak about this in general terms and try to make it as specific as possible while I'm speaking here. I can do that when we talk either via telephone or email. But to be that specific here, it's impossible, because there's over 7 billion people on this planet, and I know that's 7 billion different types of cocktails, if you will. So the reason why a lot of these plants, remedies that we get into, yes, they are symptom relief. Yes, they do actually benefit you long term, on a much greater level than the pharmaceuticals do. However, the reason why they don't necessarily always work, or they end up falling short, is because of your bio-individual system, of what is necessary for you. And until you actually can step away from being emotionally attached to what's happening and be able to just focus on what is going on for you, in a sense, from a broader perspective, this is why it's beneficial to work with a professional who can actually hear everything, because that's the most important component. The symptoms are necessary, but it's not just the pain. It's a combination of the fatigue, it's the irritability, it's the insomnia, it's the hypersensitivity to light and sound. These are all symptoms. And depression, my goodness, blood pressure issues, blood sugar issues, these are all symptoms. And when we recognize that, diabetes is a collection of symptoms, as is lupus, as is multiple sclerosis. These are all collective symptoms, but there again, if you look at them, they also have a broad spectrum of how they manifest. So recognizing the individual symptom is important. Seeing the health condition that you were diagnosed with or are being diagnosed with is important. And then looking at all of those symptoms. And I just want to reiterate, I've said this before, if you have a number of health conditions that you're being treated for, you aren't necessarily dealing with three or separate health conditions. I don't know why I said three, but you're not necessarily dealing with separate health conditions. You're dealing with one health condition that is manifesting in different ways. But if you break it down, you'll find that the chemistry is incredibly similar, and it makes a lot of sense when you look at it from a broader perspective. So I offer that to you today, because that's where grace comes in, is when you are accepting of where you are and the symptoms that you have, and recognizing that this is a message to you to make the changes in order to accommodate. And again, you don't have to do it on the first day. If you get yourself a couple of days and nothing is improving, then you might want to consider a change. It might be in a product that you're using. It could very well be a food that you're eating. It could be a pharmaceutical. These are very important components to remember. And the other piece to this is with regards to the terminology that's becoming more popular is pharmacotherapy. Pharmacotherapy is no different than taking medications. It's just applying it. It's considered more of a personalized process of using medications. And again, it's the personalization is incredibly wise. And I sigh because I wanting to come up with a word that doesn't disempower this technology that we have. At the same time, I'm a bit concerned because there are researchers out there that are speaking about and educating on the use of pharmacotherapies in relation to addiction. And what my concern is the terminology that they use. And this is not my quote, this is their quote. And a quote that I have overheard in these talks is that they're trying to shut the limbic system down. They're trying to shut a portion of the brain down so that the cortex, which is the thinking and the reasoning part of the brain, is better able to incorporate the information coming in without the attachment of emotions. Well, unfortunately, the neuroendocrine system is actually housed in the in the limbic system. It's where our chemical messengers are. This is our emotions, what our sensitivity to the world is what regulates these chemicals. And so to actually shut the brain down, or not necessarily shut it down, but that's the term that they use. So that just was like alarming to hear that. Is a concern when I think about health conditions overall, not just with addiction. And these medications do affect our genome. They affect the epigenetics, the methylation pathway. And they will often talk about this in relation to drug and alcohol use. But I want to say that this is all drugs. This is all chemicals. This isn't just the street drugs. This is every chemical that is introduced into our body via inhalation, ingestion, application. It doesn't make any difference how you get the chemicals into your body. They just are absorbed. And when we know, everything is changing the brain. Everything is changing, I shouldn't say the brain, pardon me, the genes. It's affecting our bodies interact with the environment. And so it's not just the street drugs and the alcohol. It is everything. It's our thoughts. It's everything that's affecting our genome. And so recognizing this through the eyes of grace, and not through judgment, but through grace, will allow you and everybody that you know and love to begin to dance and make the adjustments. And it might be a really great way to talk to your kids about the use of alcohol and drugs, as if they actually know that everything, if they start to learn that everything that they take in, that everything that they consume, whether they voluntarily or involuntarily, is altering their genes. And this is the most important component to the technology that we have, is that it is affecting us. And being cognizant of that, to be able to, again, dance and make the adjustments, and to do it as naturally as possible as you incorporate the technology that we have, you are then now treating the body holistically. If you have any questions, you know how to get a hold of me. You can comment below. You can message me personally. I'm always happy to consult. This is really necessary to learn how to do. It's not the be-all, end-all, but it is a way to actually find our way back to recovering our health, no matter what health condition you have been living with. It's really an important path to walk. And if it works for you, then yay for us. Anyway, have a beautiful weekend, and thanks for tuning in. Bye now.